Good evening, everyone. How are you?
Good evening, Miss Nesma. How are you?
How are you? Can you see me?
Yes, sure. Wonderful.
How are you all doing?
Fine, الحمد لله. Thank you.
طيب الحمد لله.
مبسوطين إن شفناكي يا مس نسمة.
أنا أكتر.
الله يخليك. عايزين نشوف آخر بقى.
لا ده أنا حبساه.
اوكي.
كونفايند كده في حتة. بس عايز أقول لك أنا مسيطرة بالعافية.
ما صعب، الله يكون في عونك.
الله يخليكم. أنتوا عاملين إيه؟
الحمد لله تمام.
You are all doing well?
الحمد لله. الحمد لله.
الحمد لله.
هنقرب 27/6 إن شاء الله.
يا رب يا مسهل إن شاء الله خير. يعني for lots of people في ناس النهارده كانت تسأل بالنسبة لإيجيبت at least يعني whether الامتحان هيكون running on time. إحنا we get updated about everything as you can see maybe a day by day. We don't know yet anything. وانتوا بتشوفوا حتى ال OET when they decide on anything they do this basically maybe a couple of days earlier. It depends on each and every country. So that's why it's hard somehow to deal with you know expectations. الامتحان هيمشي، الامتحان مش هيمشي، الامتحان هيتم مش هيتم. We still don't know. Hopefully inshallah that the exam is on time. بالنسبة للأونلاين experience, I will just mute all the mics if you don't mind. Okay. So regarding the online test, so far the first trial will be on the 25th of this month. We don't have lots of information yet. Basically, even as official providers, we still are not updated. We have a weekly meeting now. We're just told to encourage you to go through the experience, which I see it's a good thing for you. طيب هل paper based test will be cancelled? No, it wouldn't be cancelled at all. So you don't have to worry about this. It's there, so you're gonna have the two choices, whether you have this one or this one. It's basically up to you. And the last and most important thing before we go through this, what is the main idea of having this class or this online session? I just want you to get familiarized with the online test, because lots of you have postponed their plans and lots of things has changed in the last few like 3 or 4 months. It's really difficult for everyone. So I believe it's gonna be better if you take the chance if you have to. طبعا هم كانوا selective وهم اختاروا ناس معينة, and I think they did that on random basis. They don't have to go through this by any considerations. ما فيش أي حاجة تخلينا نقول إن هم خدوا ده أو خدوا ده بناء على حاجة معينة. It's all depending on random choices so far. إن شاء الله الناس اللي داخلة يوم 25 I believe إن هي هتكون good experience for you. نتمنى إن الناس دي تشاركنا الاكسبيرينس بتاعتها بعد ما تخلص وتقول كانت حاسة بإيه، كان الوضع إيه، كان هل في نفس التنس والستريس and so on. بس and so يعني we all hope إن شاء الله إن هي will go well for everyone. Now I'd like to يعني برضو randomly choose two candidates who run the role play with me. I can see here, ما شاء الله, and we have like 33 candidates who would like to share. Just raise your hands give any sign, say me. But before we do this, you have to make sure that you will turn on your camera, and you will be recorded, okay? And this session will be published on the group as well. So you have to approve this before going ahead. So who is going to share? And hopefully ما حدش يقول لي ولا ما لاقيش ولا حد مش عايز يشير عشان كده تبقى باظت كده باظت خالص. Okay, would like to share? ايه ده مفيش حد؟ انتوا جايين ليه؟ جايين تتفرجوا على اللي هيشير صح؟ اوكي طيب. اوكي. It's up there يا دكتور. مفيش حد هيشارك يا جماعه، انتوا جايين ليه يا جماعه؟ انتوا جايين ليه؟ Honestly. Okay, we have a question here, please, regarding raising sleeves and pants for security check before the test. As a veiled woman, I don't want to do that. What can I do? Okay, you get checked by a female security checker. Don't worry about that. That will be run by a female security personnel. You don't have to worry about that. Okay. You're welcome. You're welcome. Okay. Let's share the screen. Okay. Here. بسم الله ما شاء الله، يعني هم كلهم حاضرين المحاضرة الأونلاين وما فيش حد فيهم عايز يشارك. طب احنا عاملين كل ده ليه؟ واخدين التايمنج ده ليه؟ وفين الناس اللي كانت يا ريت يا ميس نسمة؟ يا ريت يا ميس نسمة بليز اعملي لنا المحاضرة. خلاص؟ فين؟ Let's share first. All right, this is one of the sample 2 cards we're going to work on today. Hopefully it's going to help. All right. Okay, so I would go through any one of you who wants to share in the speaking. If you want to share your screen, that's okay, no problem. Okay, بس انتوا بقى ايه اللي بوظتوها مش انا. عشان ما حدش يقول احنا نسمع ما عملتوش. Okay. No, okay. All right, let me see that. Right, I'm going to go through it. Okay. Okay. Your mic is supposedly unmuted now. Your name is Dr.
Naira.
Naira?
Yes.
Yes. Hello, doctor. How are you?
Alhamdulillah.
Alhamdulillah. Okay, doctor. Are you ready to go through the speaking test? I know you are off camera, right?
Yes, yes.
Okay. Okay. Raised other 2 participants raised hands. Okay. So let's see. دلوقتي طبعا ما بقى مفيش كاميرا كله بيريز hand. Okay. How are you going to go through it? If you're not going to go through this camera testing, okay. Okay, on the real test, you'll be doing this. The interlocutor will be facing you the way I'm doing right now, and supposedly your mic will be on, okay? And you will be ready actually to be seen fully, okay? You'll be having your card in front of you, just like the one you're having right now, right? And you'll have the time to read, okay? And you will have the time also to take down some notes, okay? So we have here also Dr. Karim or Karim. Dr. Karim. Wa alaikum salam. Okay. Dr. Karim. All right.
أخدتك يا مس.
الحمد لله. زي حضرتك.
الحمد لله بخير.
Okay. Are you going to share?
لا كاميرا بلاش.
لا أنا I'm asking are you going to share? That's it. أنا لو قلت لا كاميرا فقدت فيكم الأمل. أنا بس بتشيك خلاص كده يبقى دكتور نيرة ودكتور كريم. Okay. طيب ladies first. Okay. So Dr. Naira.
Yes.
This is your card, the one you can see here. Okay. Yes. You will be having exactly 2 minutes to read, and then we are going to start. If you have any questions, you can ask me during the preparation time, but you cannot do this after the time is off. Okay?
Yes.
Okay, you can go ahead. Okay.
Can I ask your name, please? The name of the patient?
Okay, you can call me any name you'd like to. It's up to you.
Yes.
You can call me by my name, Nisma. It's okay.
Yes, yes.
Ready to start?
Yes, okay.
Okay, you can go ahead.
How are you, Miss Nisma? Welcome back. How are you today?
Well, doctor, I'm still really scared and I'm not feeling good. I really know what's happening to me.
Fortunately, the results of the test of your tests came back, and fortunately, it is very good. There is no heart attacks. There is no heart attack.
What do you mean by this? I don't understand. I
There
had
is no.
all the symptoms of a heart attack.
Yes, I understand your worry about your you to be having a heart attack, but fortunately, the results confirm you are free of heart attack. Can I ask you some questions about surrounding substances?
Okay.
Do you have any stress at work?
You know, regular stress that everyone could be dealing with.
Yes. Is this affecting your sleep? Is this affecting your family?
No, I think I sleep well. Maybe sometimes I have some over stress in my work. It could affect me sometimes, becoming a little bit nervous, maybe anxious, but it's not that bad.
Yes, I understand your worry, Miss Nisma. But actually, your condition may be a panic attack. You know, my panic attack. Can I explain to you? Panic attack is a stressful condition leading to chest pain due to muscle contractions. So you feel pain due to the stress, not actually the affection of your heart. You understand me?
Okay, doctor. I do understand that you're trying to make things a little bit easy for me, but I know that I had a heart attack. This cannot be a panic attack. A panic attack, you would feel like a little bit stressed, maybe not breathing well because of your stress or your fear, but not that severe chest pain. It was unbelievable.
Yes, yes, I appreciate your feeling of the pain, but sure and honestly, there is uh, no positive result of the investigations we have done. So mostly your problem psychologically. So I will refer you to a psychologist to assess your case. Are you okay?
Well, doctor. Okay, I do believe that this could be a little bit not accurate enough. Maybe we need further investigations or further tests, but I don't believe that I didn't have a heart attack. Don't try. There must be other tests more accurate. Maybe there's something wrong with the results. Who knows?
I
Can you
will
repeat them?
I will recommend you some relaxation tests, and you should make some uh, exercises to alleviate your condition. And in the same time, I will recommend you referral to the GP to discuss ways how to elevate other ways to elevate your condition and the stress. And I think this will make a good result in relieving your condition. But there is
Well,
actually,
no. I
honestly
feel
speaking,
like you're making
honestly
this very
speaking,
difficult. You're making this very difficult, doctor, and you are trying to, waste time. I don't know. You're taking this very difficult, and you're making things very long. Just give me maybe a paper so I can go and find other tests we can do. Examine me one more time, but not just like this. Don't tell me to go to my GP and no, this is not
I will,
acceptable.
yes, I understand your worry, Ms. Nesma, I understand well. And I will make a referral to a professional to make management plans to alleviate your condition. But I'm sure you will be, you are good, you have no heart attacks, and you are very well. Do you have any other questions?
I don't think so. I just need you to tell me what other measures I can do until I find out what is really wrong with me. Do I have to take medications?
This I will not recommend the medication. The professional, the professional person who will make advise you with the medication.
Okay, so nothing, just nothing. You will.
Yes, I reassure you, your condition, you don't have heart attack, and I recommend you to make exercise and to relax yourself and to take rest times, and don't think too much, and don't worry about your condition. I will recap for you. Your test results are very good, and you are fine. You don't have any heart problems. You just have a panic attack, and this will be relieved just with some relaxation. And I will try to refer you to a psychologist to relax your condition.
Okay,
I hope you will be very well soon.
okay, thank you.
You are welcome.
Thank you. All right. This is a very reluctant patient. Okay.
Yes.
Very reluctant. I know myself. Okay.
Yeah.
All right. We do have two types of patients usually. A patient who is reluctant whatever you're saying because he's in denial, like this person, or because he already has stereotypical ideas about some diseases or some conditions. So he would, in both types, he would find it difficult to believe whatever you're saying, whether you're saying you have or you don't have the disease. So we have here a person who believes stereotypically, and he thinks that he has demonstrated all the symptoms related to a heart attack. That's why he cannot believe you, okay? He will be against you all the time. So it was like my word against your word. One of the most important things in such cases, when you find that the patient from the very beginning, he was just saying no to whatever you're saying, okay, to try to control the time, okay, to try to control the conversation. He was trying to tell you that there is something wrong with the tests or the investigations. And because you were trying to interrupt me, because you are actually, let's say, having some serious thoughts about talking about the everything in time, so you were interrupting him or her, you were trying to push your talk, you were trying to push your questions, you didn't hear me well. Whenever the patient starts to talk, you just stop, okay? I asked you, can I repeat them? Okay, you should have answered me. You should have told me, well, it's up to you, of course, but let me tell you that this is a very complicated situation. It's not easy to ask someone to repeat the investigations, especially that they are very accurate so far, okay? But again, you have the freedom to do everything you want, because you know, abroad it's not like here. It's not easy to get an appointment with a specialist. It's not easy to go through investigations. Everything should be done whenever it's really needed, not haphazardly. So overall, let me talk about your card overall. You were able to start well, okay? You were able to present the issue. However, you were a little bit not in control. I was pushing you around, okay? How to get control, to understand the patient perspective. So when I told you I have every symptom of the heart attack, well, I understand. Yes, lots of people who would face such symptoms, maybe they will think of a heart attack, because anyone who has gone through this experience is around us, okay? We have friends, family members who have been through this, and it's usually the same common symptoms. So yes, I understand how you feel, and just let me explain to you more about the panic attacks and how similar they could be to the heart, okay? So in that type of way, you try just to calm them down and you try to win time, okay? So they wouldn't argue that aggressively, okay? They might be aggressive and they might be really pushing till the end, like what I did. That is pretty normal. That happens all the time. It's okay, all right? What is really important, that you stay in control. You presented everything, that was good. You tried to show everything. You tried to answer most of his fears by trying to calm him down, but the emphatic language could have helped you a lot. I understand how you feel. This should have been a really difficult experience for you. You can also use your medical experience by telling him what other symptoms of a heart attack he might have experienced, okay? And he does not have any of these, okay? So what was on top in your card? You interrupted the patient. You were trying to have a raised voice over the patient just to silence him. That would never happen in a real test, okay? This alone could fail you the card, by the way. This mistake by itself would fail the card. Secondly, try to be more emphatic with the patient, sympathize with their situation, understand this perspective. Try to improvise sometimes. الامبروفيزيشن يا جماعه الارتجال مش وحش. ما بقولش ان انت تطلع اوف بوينت 100% وزي ما بقول كده في الكورس يعني وتطلق العنان للدكتور اللي جواك يظهر بقى، اوكي؟ لا انا بقول ان انا ممكن استغل الباك جراوند بتاعتي، الميديكال باك جراوند، انا بقول له ان في كذا وكذا، ده السيمتومز دي ما كانتش موجوده، فده دليل برضو ان دي مش هارت اتاك فور اكزامبل يعني. alright. طيب
Yes, yes, thank you so much.
حاجه كمان برضو عشان انا كنت كاتباها هنا، فكره المالتيبل questions. خلي بالكم يا جماعه من الحته دي. do not ask too many questions. يعني tell me a little bit about your job. Okay, do you have a stressful job? How this is affecting your lifestyle? Is it affecting your sleeping? Is it affecting your lifestyle generally? How do you feel? Okay, so you can ask very accurate questions about this, but each and every one in a row. Okay, but thank you, well done. Okay, so before I go, let me just ask one more time. Is there any candidate who would like to share in the experience by camera? Okay, just like the real test. If you do, if you want to, just raise your hand. Okay. أنا بس بدي فرصة، أنا عارفة الضمير. أنا بدي فرصة عشان لو حد عايز يشترك واي كاميرا. في حد يا جماعة عايز يشترك as an online test, a real online test? هلا أونا، هلا دوي، هلا تري. أنا عملت كده عليا. Okay, so supposedly we had before we started, Dr. Karim, are you still there? And can you hear me? Okay, let me find him. Dr. Karim. Okay. Okay. So we need a male participant if Dr. Karim is not available. Okay, someone to go through the second role play. If you want to share, just raise a hand. انتوا مطلعين عيني، يعني ابوس ايديكم عشان تكتبوا، ابوس ايديكم عشان تحضروا، ابوس ايديكم عشان اعمل لكم اونلاين سيشنز. اعمل فيكم ايه طيب؟ Okay, let's look here. Okay. يا جماعة مين عايز يشترك؟ time is running. أي حد who wants to do the second card without a video. Two participants raised hands. Okay. Okay, Dr. Tor. Okay.
Yes, how are you?
وعليكم السلام ورحمة الله وبركاته.
ازي حضرتك؟ ميرسي جدا.
الحمد لله. يا أهلا بيك يا فندم.
اهلا وسهلا بحضرتك. Actually, it's for my first time actually to express this OET examination. So
Okay.
I don't have a lot of information about it, but I see that the speaking session is very nice. So actually, let us see what I can help.
You can do the best. I know that. Okay. And I'm really happy when I have candidates who are first timers. Okay.
Yeah.
And I wish, inshallah, when you get to the test and do it, just give me a call and say, I did it.
No,
I loved it.
actually, I just was a lot during the experience with IELTS from long time. But
Oh, yeah, I know.
I just hear it because he
I know,
always
my
is
son. I
writing
know what you've been through.
6.5, so it was very really frustrated every time.
Yeah,
So I
I know.
give up.
How many times did you go through it?
Actually, maybe 6 or 7 times, maybe from 5 years. Then I
Oh.
go to my job and work. I forget it.
The best thing you did that you forgot about it. I teach IELTS and I found it very difficult. I know.
Actually, I don't know. There's things that are something problematic about this writing because all of people get 6.5 for a long time. I don't know why. Even they're very good. So maybe it's business or something. I don't know.
Yeah, definitely. Part of it is basically business. Secondly, unfortunately, it's really hard to tackle what the examiner needs, and it takes lots of time and effort to research and practice more than even study. And, you know, there are lots of things, but hopefully you will find it better experience regarding the OET. Inshallah, you get it from the first time, bismillah. Okay, so as a first timer, okay, I don't know if you know much about the speaking exam, but on the speaking exam, you will have 2 cards and you will do each and every card separately. You will have preparation time for each and every card separately as well.
Okay.
And basically, you will have like 2 to 3 minutes. I expect that in the next few months, they will stick to the 2 minutes because there will be lots of postponed numbers and they will try to cover as much and as many people as they can per day. So let's do the way I do it in my class. 2 minutes preparation, okay? And then I'm going to start talking with you for 5 minutes. Through the 2 minutes, you can take down notes. The card will remain ahead of you for the rest of the speaking part. If you have any questions regarding the speaking, you can ask me through the preparation time. After that, I wouldn't be able to answer any of your questions. Okay?
Perfect.
Ready?
Thank you. Ready, sure.
Okay, you can go ahead.
Okay, here's me. I think I'm ready. So it seems this patient is the father of son and daughter. Okay, that's it. So I'm ready.
Okay. Okay.
Yeah. Okay, I can go.
Yes.
Hello. So just there's any name for this person? His what
You
his
can
name?
ask about the name, or you can just make up a name of your mind. Talk to me
Okay.
by my name. It's up to you.
Sure. Hello, it's me, Dr. Tariq. I'm here to visit you and just to talk with you about the results of you, Mr. I don't know what's the name, is Mr. Mohammed, for example. Yeah, you was here admitted yesterday. You come with some sort of fever, and you have a bad problem about your knee. I think it's something like swelling. That is, your knee is a bit edematous, as we said in other medical words. So we did some lab investigation to check what's going on with you. Now the lab results come. Let me just explain and discuss it with you if it's possible for you.
Okay.
Okay, what I can see from this lab result, we have a minor infection. This infection is called bacteria. It's called Staphylococcus. Not about the name. It's called golden staph, if you want to say, express this to discuss it, or just to search on the internet for that. Of course, because you have this hernia surgery before 1 week ago. Unfortunately, there's results. Maybe this infection can affect you in some way. So you can have a problem in this knee, like septic arthritis, these things that make swelling. All this infection may spread a bit in your body and may affect sometimes the heart. And it's not a big deal actually, but we must be sure that this problem can be solved and under control. So what about I expect that the cause of this one, it is very common bacteria, especially after surgeries when you have a wound and your body is still not in the best condition. So it happens somehow. We can say it is very common. So you can say it can. This means that it can happen every 5 to 10% every 100 patient.
Well,
In
doctor,
another,
may I ask a question here?
sure.
I'd like to know exactly how did my father got this infection?
Actually, the problem, we're not sure yet how it comes to your father, but the problem is because the wound was opened, so it either can come from another place before he come to our hospital, or it could also come from some sort of
He
hospital
was
acquired
okay
infection.
before the surgery.
Yeah,
Okay.
sure, I
So that
understand that.
definitely some kind of infection he got from the
Yeah.
hospital.
Actually, I'm not sure actually what is the source, but it seems sometimes it happened at hospital acquired infection. But don't worry at all. This condition happened, and it is, as we say, it's very common, and it is under control. I'm so sorry to know that happened to your father. I know it is a bit worry. Don't worry at all. It is very common, as I said, and also we can deal with it with first line management, antibiotics, and it is very responsive to that, especially if we do culture and get the best and the most suitable antibiotic for that. So
Well, I'm so sorry.
sure.
I'm so sorry, doctor. Now, you're
Yeah.
telling me that this could have happened through the hospital. So that means there's something wrong in the medical team here. Maybe he wasn't quite treated. Something was wrong with him.
Actually, yes, you are in some ways. You can say you are a bit right, but I want to recheck again. I want to tell you that hospital-acquired infection is already happening. Although we did all infection control measures that we can do, it's still possible. But that doesn't mean we'll not investigate for the cause of that, and we'll check what's happening and why it happens. But from your father's point of view, don't worry at all. We cover everything in this infection. We'll get the antibiotic for you. Mostly this staff, as I said, it responds very, very good. And the response for antibiotic is almost 90% or something.
No, no, I'm sorry.
Sure.
I will file a complaint against the hospital, and I wouldn't accept this. My father is now being treated or whatever. He's going to suffer from this. I don't know how this is going to end up because of your mistake.
Yeah, don't worry at all. I just want to reassure you that nothing will happen to your father. This is very common, as I told you. Just be relaxing. I wanted to give you every possible investigation, extra investigation if we need. I want to assure you, the father will not have any problem in his life. Just be isolated for a bit. But you can see him very good. You can come and see him. This is just for his sake. He
No,
will cover.
I wouldn't. No. I wouldn't accept this. My father now is being isolated, and I don't know. This is something like he's paying for your mistake, guys.
Actually, this is for his sake now. We need to protect him and protect other patients and protect you, everybody, because we don't want any infection to other. So this is not 100% way to deal with this situation, that we need to solve it. Of course, I know that your father will be in some few days of isolation, maybe a bit psychological or stressful situation.
Okay, time is up.
But
time is up. Time is
sure.
up. Okay, I give you an extra 1 minute. Okay, so you're doing a good job. I respect that this is your first time and you were able to do this. Let me tell you something. I guess I heard you saying wanna. Okay, so wanna is not accepted. Okay, what happened here is that you talked for a long time without giving your listener or the other side a chance to interact with whatever you're saying. It's really important at the very beginning when you talk to me and you tell me yes, you understand what's going on with my father, pause and tell me, what do you think about that?
Okay.
How do you feel? Do you think it's clear? Get me participated in the talk. Do not just talk by yourself, okay? And let me wait all that time. I was waiting, that's why I interrupted you, okay? I didn't feel like there is a two-way conversation. It was just one-way talk, okay? Usually patients like to take things step by step, or caregivers, okay? So just tell me first what happened. We don't know the source yet, okay? Maybe you can delay a little bit how he got this, okay? When I tell you that this is the hospital responsibility, then you would say, yes, that could be one of the suggestions. However, I'd like to tell you that so far it's a common condition that may happen not to a lot of people, but yes, it happens. Okay, and as you said, maybe he got this infection before the surgery, during being in the hospital and so on. When I said that I will file a complaint and so on, well, I appreciate how you feel. I understand that this is really difficult. Understand that you care for your father, and of course, it's really hard situation for you to see your father like this. But first things first, we need to think about your father's condition. يعني بمعنى أصح بالعربي كده، امتص الغضب وبعدين ابتدي تعامل. انت كنت بتشرح واكسبليناتوري وجميل جدا، بس still أنا aggressive. Okay, because I don't know what happened. I demand explanation. So هنا بيكون حلو قوي ان انا اقول له انت من حقك تعمل اللي انت عايزه. يعني لو عايز تفايل كومبلينت فايل كومبلينت، بس مش نظام اعمل اللي تعمله. عارف انت اللي هو فايل كومبلينت اعمل لك ايه يعني. تمام. لكن well, I understand you're anxious, you're angry, and I understand why you're feeling that. I understand how it's difficult to see our parents in such pain or situation whatsoever, and it's totally right to take whatever action you feel appropriate. However, for me as a health provider, what's really important to me now is to help your father. Let's start with a treatment plan first, and then all other stuff can just go through time and take their time. We would never stop you from doing anything. It's your freedom to do whatever you want. فهمها ان انت من حقك تعملي اي حاجه، لان انا لو انت يعني ما سمعتش منك الكلمه دي، انا كل كلمه ونص هتقولي لي هقول لك انا هشتكيك، ده انا هعمل فيكوا، ده انا ههد عليكم المستشفى، فاهمني؟ مش هسكت، فاهمني؟ فبيكون مهم بقى هنا جدا ان انت تكنترول البيشنت شويه، تمام؟ اللي هو بتضحك عليا يعني بالادب، بس بتضحك عليا، فاهمني؟ بس اوكي، بس طبعا ويل دان. اوكي، انا مش من الناس اللي بتحب يا وانت بتسمعني، يعني اللي هو يا ليه؟ لان from my experience as a previous interlocutor and dealing with the educational team in OET، هما بيعتبروا ده شويه ان انت you are يعني بتحاول تقولي go ahead، يعني ماشي ها قولي، فاهمني؟ عكس ان في الكوميونيكيشن سكيلز مثلا بنقول ان ده من نوع من انواع الافكتيف listening. اوكي، ان انت انا سامعك، يعني I'm following up with you. So اسمع without interaction, without words, just listen, and after the patient is done talking, you start talking. Okay?
Okay.
بس طبعا well done as a first timer. Well done.
Thanks so much.
Thank you. طيب انا محتاجه ان انا اعمل ستوب للشير واشوف الكويستشنز هنا. Okay, so all right, how do we do the introduction? Okay, I'm gonna mute everyone just to, okay, and let's stop the video here. Guys, before you come in, just make sure that you're not turning your cameras on without noticing. How do we do the introduction? Introduce myself. If you don't know the patient, definitely you're going to introduce yourself like I'm Dr. Nisma, I'm the treating physician, I'm the GP, whatever you like to do here today. And would you tell me what is bothering you? You look anxious. What seems to be the problem? طبعا انا بحب بقى دايما ان احنا ناخد بالنا من الانترودكشن مع السيتويشن. يعني انت مثلا في سيتويشن مثلا emergency department مثلا، يعني وضح ان انت understand there is something wrong. Would you tell me what's going on? What happened? Okay. Ms. Nisma, how will this conversation be graded? You mean the first one? Okay, the first one, definitely it will be like 300. Okay, and also the second one, by the way. And as I said, there is a major reason for the first one to drop down to 300. Okay. I want to perform but without camera. Okay, how do we do the introduction? Introduce myself for the last card. Well, you can deal with the patient as a new one, or the caregiver as a new one. But however, I would like to go through it as I know this person. He was admitted yesterday, as she said. Okay, because of unexplained severe swelling of the knee and fever. So at least the patient was here a couple of days or yesterday, so at least I saw him or something. So I would start with, hello, how are you doing? How is your father doing now? Or if she hasn't seen me yesterday, at least I know about them. Hello, I'm Dr. Nisma. I'm responsible for your father's condition. And first of all, I'd like you to sit down, maybe, yani, something like that, or to be comfortable. And if you're ready, we can discuss your father's results. and then you start talking. Can we say some information more than that is written in the card? والله يا دكتور it depends. يعني في ناس بتسرح زي ما قلت من شوية، في ناس بتطلق العنان بقى كده وتكمل، لكن ممكن لو أنا حاسس ممكن في cards بتكون قصيرة، يعني في cards بتكون very very short. Okay, so it's really difficult إن أنت to keep them يعني going for 5 minutes, so you can add some information maybe. All right. I can participate with opened camera. Okay, Dr. Hagar, we can do another card now, or at least we repeat the first card. Is this role play considered first visit or second visit? As I met his son, not the patient. Yes, as I said, they were admitted yesterday. So basically it can be like a second one. This is how to absorb the patient's anger again, please. Try to talk to them calmly. I understand how you feel. I understand that this is a very difficult situation. لو هو parent مثلا بقول له, any parent would find this really difficult to deal with regarding their son or daughter. If they're a caregiver, I know how hard to see our parents in such situation. Okay, I understand where you come from, right? Okay. So Dr. Hagar, if you're still there and you're still interested, we can do one with an open camera.
Okay, doctor, I'm here.
Okay, where are you? I cannot see you yet.
Open camera now?
Yes, please. Hello.
Hello.
How are you?
I'm fine.
You look beautiful.
Thank you.
Okay, so I'm gonna share the card, the first card again.
Okay.
Okay. All right. Here we go. Okay. So let's go through the first card one more time, right? Again, you will have 2 minutes. Read the card. Okay. Would you please adjust your camera just a little bit so I can see you? Yes, I can see like the desk or something. Yes, that's what's gonna happen on the real test, by the way. عشان بس ما تبقوش متفاجئين. لو حد هيخش اونلاين خاصة طبعا لو هيجو through الرايتنج، هيبقى طالب ان هو يبقى شايف المحيط اللي حواليك and so on. Okay, you will have 2 minutes. You can take down your notes. If you have a question, you can go ahead and then we can start. You have 2 minutes counting from now. Okay?
Okay, I'm ready.
Okay. Let's get started.
Okay. Good afternoon.
Good afternoon, doctor.
May I confirm your name, please?
I'm Nisma.
Nice to meet you again. How are you today?
I still have this pain. This chest pain is just unbelievable. And I feel a little bit nauseous as well.
Yes, I'm sorry about that. We have received your results, and I see that there's no evidence of a heart attack. I think it's likely to be a severe panic attack. What do you think about that?
Well, I don't know, doctor. I don't think what I've experienced is is not a heart attack. It's really difficult. The chest pain, I've never been through this. I'm still having this lingering chest pain. It's unbelievable.
Yes, yes, I can understand your concern. It must have been so stressful for you, but let me explain to you that the results are clear. And sometimes panic attacks are associated with severe chest pain like you have, caused by muscle contraction. Am I clear so far?
Okay, but are you sure about the results? I feel they might be mistaken.
Uh-huh. Okay, sometimes it happens, but I want to ask you more further question about your life. Do you mind?
Okay, no problem.
Okay, what kind of work do you have? It's a stressful condition or everything goes smoothly? Tell me more.
Well, actually, it's a high pressure job. I'm a lawyer, you know,
Yes.
and most of the time you have lots of things to do. Sometimes I have to, spend the whole night preparing for a case, researching something.
Yes, okay, I appreciate that. What about your family issue? Anything that stress you more?
Well, yeah, you know, sometimes stressful jobs can lead to some, you know, stress atmosphere at home. But,
Yes.
there are problems I can handle.
Okay, and what about your sleeping pattern? If there's any problem with that?
No, I think it's okay. I think it's okay.
Okay, I want to ask you, before the chest pain started, do you notice anything that triggered or you notice something that caused the chest pain? Do you remember?
What do you mean by a trigger? I don't understand.
Like doing exercise or some strenuous work,
Mm.
you know.
No, no, I don't think so. I don't think so.
Okay.
It was
Okay.
just like a normal day.
Okay, I suggest to you to have a visit to your GP to discuss way to elevate your stress, as you mentioned, and maybe you will need a referral to psychologist to help you with more information how to
No,
deal
no,
with.
no. A psychologist?
Uh-huh.
No, I don't think so. I can handle my problems. I've been
Yes.
handling them for a long time.
I can understand your worries and concerns, but let me assure to you that psychologist will help you to deal with these things that may bother you or cause the chest pain, and he will confirm or exclude the causes, other causes, so we can focus with the actual cause, so we can handle it. What do you think about that?
Well, no. Look, doctor, I still believe I've been through a heart attack. It's really clear. I have a friend who has been through it, and he had almost the same symptoms.
Yes.
So I need to redo all the investigations, and maybe you can refer me for further tests. I don't know. You name it.
Okay. I'm sorry about your friend, but let me suggest to you to follow some instructions. If it's not elevate your symptoms, we may repeat the test as you like. Do you mind if I discuss this techniques with you?
Okay.
Okay, there's a lot of techniques that can help you to elevate your stress, like doing regular exercise or meditations. I assure you that importance of counseling a professional psychologist will help you to make a management plan to stop the problem from getting worse. What do you think about that?
Well, I don't know. I feel like psychologists are just a waste of time and money. I don't think so.
Okay, it's your choice. and you have all the rights to decide what you will do. But my
Maybe I can
suggestion.
see the GP only.
Okay,
but I don't,
that's
I
right.
want to see the psychologist.
Okay,
I don't
that's
recommend
right.
it.
And the GP will help you a lot. Do you have any other concerns?
No, I don't think so. I think everything's clear.
Okay, do you mind if I summarize what happened today?
Okay.
Okay, you came to me as a follow-up visit, and I have received your test. There's no evidence of a heart attack. I discussed with you about what may cause you panic attacks like stress in your work and family, and I suggested you to see a GP to help and psychologist to help you to manage your stress. And you agree with that? With visiting a GP. Am I clear so far?
Yes, I guess so.
Okay. Do you have any other questions?
No, I don't think so.
Thanks for coming to see me. Don't hesitate to call me if you have any other concerns anytime, and I wish you well.
Thank you. Well done.
بجد؟
Well done. والله well done جدا. Well done على الآخر.
طيب great.
لا حلو جدا يعني I guess ان انت you covered everything. You were able to give space for the patient. يعني I tried to present another reluctant typical patient. مش شرط reluctant يبقى aggressive all the time. يعني أنا I was reluctant but I looked nice. I was trying to be nice. Okay. So you were able to deal with his fears. You were able to deal with his concerns. Okay. عجبني بقى قوي الجزئية الأخيرة لما نطيتي على حتة ان انا عندي بس السجستشنز وهنتكلم فيها كرد على حتة لا وهنضيع وقت وهنروح لسايكولوجيست وانا ههندل المشاكل ومش عارفه ايه. طيب ودي نفس اعراض صح. انا شكرا انا زعلانه قوي على صاحبك ومعلش وحقك علينا كلنا. ان اس كله في العالم بيعتذر لصاحبك. بس ايه رايك انا هقول لك على السجستشنز دي حلوه جدا. انا هنا بحاول اتوه وبكمل الكود بتاعي. لان هو طبعا لو استمر على الوضع ده ما فيش كارد بقى ما فيش حاجه هتكمل. تمام. هنا عجبتني قوي الجزئيه دي ان انت عرفتي تنطي من هنا لهنا. فويل دان طبعا يعني كويس جدا. الاستراكشر كان كويس. اوكي. I think يعني انا هفضل هنا انك تبداي ان انت عارفاني على طول لان اوريدي انت عندك باك جراوند عني فمش لازم تكونفيرم النيم ولا حاجه من كده. خشي على طول ان هلو. انا دايما بقول you can use a definite name وتخلي معاه مستر او مسز. تمام. all the time يعني استخدمه مع اي حد حتى لو انت كان في الانترلوكيتور ما عملش introduction ودخل على طول زي ما عملنا كده النهارده دخلنا على طول واشتغلنا ومش عارفه ايه. فانا ممكن ابقى مجهز نيم بتدرب بيه. تمام. لكن overall لا well done طبعا. You covered the structure, you asked questions, you clarified everything, you were able to listen well. Okay, you asked questions one in a time and that was really good. Okay, if I'm going to grade it, it's going to be 350 and above, and it can reach up to 400 or something. Well done. Thank you, and thank you for sharing. Thank you. طيب, I'm going to stop sharing here again, and I'm going to go through the questions one more time. Okay. First. ايوه.
هو احنا ممكن نقرا من الاسئله من الورقه اللي فيها الاسئله دي تبقى قدامنا عشان نتكلم عليها ولا احنا بنعرفها مره واحده وبنتكلم بعد كده من غيرها؟ الورقه اللي فيها
لا بتفضل موجوده معاك طول فتره الامتحان.
ونقدر نبص عليها
يعني
احنا
الامتحان موجوده قدامك. لو في البيبر بيست هتفضل موجوده قدامك وبيبقى متاح لك انك تاخد نوتس وانت بتسال تطلب ان انا محتاج ورقه وطبعا بنسل ممكن يبقى معاك او هي مجرد ما بنخش بنديلك على طول الورقه والبنسل. في الاونلاين هيبقى برضو معاك مساحه انك تاخد نص وهتفضل قدامك زي ما سبتها كده على السكرين all the time.
اوكي ثانك يو فيري ماتش.
دكتور نسمة.
ايوه
دكتور نسمة، اللي في الكارد اللي فات دوت هو ما ينفعش اتعامل مع المريض كأن انا ما اعرفوش مثلا وان هو عامل ريزلتس بره فجاي لي بالريزلتس دي فانا مثلا بتعرف عليه اول مره اقول له يعني ايه مشكلتك وكده.
قولي لي ليه؟ طب ليه بقى؟ ايه الحكمه يعني؟
يعني قصدي يعني اخاف لما انا مثلا اكون لاول مره ما اعرفوش واتعامل معاه بالطريقه دي، هو اصلا اوريدي انا عارفاه انقص ولا حاجه، يعني انا ما بعرفش افرق انا عارفاه ولا مش عارفاه.
طيب بصي يا فندم، هديكي حاجه بسيطه جدا. انت نفسك قلتي هو عمل الانفستيجيشنز، تمام؟ عمل الانفستيجيشنز بناء على طلبك، اوكي؟ وانت حاليا بتتكلمي معاه. اي حد جاي بيتكلم معاكي في تيست ريزلتس، اي حد جاي بيتكلم معاكي في اكس راي، اي حد جاي بيتكلم معاكي في نيكست فيزيت او يعني فولو اب فيزيت، كل دول انت تعرفيهم. مين اللي ما تعرفيهوش؟ اللي جاي لسه بيشتكي. لكن كل ما السيتنج والكونتكست بيقول ان الراجل ده جاي لك علشان حاجه من الكلام ده، جاي ديسكاس معاكي حاجه، لا اكيد انت تعرفيه.
تمام ماشي.
فاهماني؟
أيوة.
وهنا انا حاساها هتبقى ويرد شويه لو انا ما اعرفوش، يعني doesn't make sense.
ماشي
اوكي؟
شكرا شكرا.
العفو يا فندم. Do I need to maintain eye contact with the examiner? No, no, you don't have to. You don't have to. As an past interlocutor, some candidates looked everywhere except me. مش حد يبص لي يعني خالص. Okay, it's okay. It's not counted. It's all recorded. Okay. حتى لو تلاحظوا انا قصدا ان انا ما ببصش للكاميرا في وقت الاونلاين، عشان عادي عايزه تبصي لي، عايزه تبصي للكارد سبتي، عايزه تبصي للنوتس بتاعتك، مش مشكله. Okay. Could you tell us the best way of 3 preparation? Could you tell us the best way of 3 preparation? What do you mean by 3 preparation? Okay, would you clarify your question? Okay. طيب في حد عنده question تاني يا جماعة before we go؟
السلام عليكم استاذ نسمة. هو انا لو قدمت نفسي والعيان واحنا عارفين بعض في مشكلة يعني ننقص في النمر، ولا ده معناه ان انا مش فاهم؟
ايوه.
اوكي. اصل واحد متعود يعني يقول هلو هاو ار يو دوينج و I'm the treating doctor وكده. لا نركز الاول، ما نعملهاش على طول، ما ندفعش.
مش الله ينور عليك. بعد كل ده انا ازعل منك انت بالذات. اطمس.
اوكي لا مش عايزين كده بعد الشر. شكرا يا استاذ. اوكي.
لا يا جماعه بصوا، طبعا طب ليه هنقص؟ عشان بس ما نقولش كلام وخلاص، لان ده جزء من الكونتكست، جزء من المنطق والحوار. اوكي، اسمه رول بلاي، فالمفروض ان انا بستوعب السيناريو اللي قدامي وبعدين بشتغل عليه. اوكي طيب 3 minutes before we start the card. What is really important to read the first paragraph. بيبقى مهم جدا لان ده بيكون السيتنج، بيديني الاهم السيناريو بيدور في ايه بشكل ملخص. وبعدين read at least the first verbs اللي موجوده في كل point عشان بس تعرف انت هتexplain هتعمل ايه. Underlining is really important. طبعا في الاونلاين تيست مش هيبقى عندي مساحه الاندرلايننج، اوكي؟ لكن لو انا بحضر اونلاين تيست ممكن at least I will write down a word referring to each point of them. انا شايفه كده. ما تكتبوش، ده رايي الشخصي، يعني عامه بشكل عام ما تكتبش نوتس كتيره. You have 2 to 3 minutes و I believe ان هم هيبقوا 2 only. وعشان كده انا حتى في الكورس بتاعي من زمان بدرب على 2 minutes only عشان انا عارفه بيحصل ايه وقت الزحمه. I don't recommend that you push ahead to write down. If you write down things you may don't have the time to complete it. طب اكتب ايه؟ يعني لو عايزه اكتب ايه، لو انا لازم اكتب، يعني انا واحد شخصيا ما بعرفش اركز في النوتس بتاعتي غير لما اكتب. اكتب الحاجات اللي انت اثناء ما كنت بتتدرب، سواء كنت بتاخد كورس او بتتدرب مع زمايلك او حتى بتتدرب مع نفسك، دايما بتتلخبط فيها. مثلا start of question معين لازم بتقوله وبتتلخبط في تركيبته، ده اكتبه اول حاجه بحيث ان انت يبقى قدامك ما تتلخبطش فيه تاني. شكرا بجد ميس نسمة، جزانا واياكم، ربنا يخليك يا رب. وكان نفسي بقى احسن من كده كمان، ان شاء الله نعمل واحد تاني ويكون افضل، تكونوا اتشجعتوا شويه. Can I say as a reminder I'm doctor and nice to meet you again. يعني عايز تقول الاكسبريشن as a reminder؟ لا مش هتنفع. Is it necessary to ask the name of the patient؟ والله it's not. في ناس ما بتسألش أصلاً عليه، يعني 90% من الناس اللي بتخش ما بتسألش على النيم. Basically لأن يعني عادي يعني ممكن اتكلم عادي ومش لازم اسال عن النيم يعني. Okay, so other questions?
Okay, I can understand. Can you please say in English?
I can hear you, Doctor. I don't know the name, it's not clear, but
I'm Afsana from Bangladesh.
Hi.
Actually, I can understand what you're saying. Can you please
Most of it, you don't understand Arabic. Okay, so tell me what your question.
I just want to know, is it necessary to ask the name of the patient in every case?
No, you don't have to. Lots of candidates do not actually ask questions. They don't do this. Okay, you don't have to ask question about the name. Maybe you will get to know the interlocutor at the very beginning, at the introductory part, and you will know about their names. Okay, so you can use it directly, or you can just skip this part. Okay, you can present yourself. If this is the first time to talk to the patient, you can present yourself. I'm Dr. Nisma, I'm the treating physician here today, and I'll be your doctor, or I'll be your doctor today. What seems to be the problem, and you can go ahead with it. It's not a must, of course. I understand from the card that this is ER sitting, and the patient presented with acute chest pain, and after history, the PE I ordered, okay, an investigation. So it's the first visit, not a follow-up visit. Actually, it's not a follow-up visit, but he already presented maybe an hour ago, 2 hours ago, who knows, okay? And that's why we're saying that you are dealing with this patient at least for a second time, like as I said, after 1 hour or 2 hours. I think according to the scenario on the card, we should introduce ourselves or not. Well, if it's a first time to see the patient, of course you will introduce yourself. It's manners, it's appropriateness to introduce yourself. Telling the patient your name is a kind of starting a friendly way with the patient by keeping the formal distances. However, it's a good way to address your patient firstly with introducing yourself. ربنا يخليك لينا. حاضر والله حاضر.
مس نسمة، ربنا يخليك يا نسمة. حضرتك قلتي الحاجة المهمة اللي نكتب فيها لو احنا يعني عندنا وقت صغير اللي هو تحضير الكارت ده، ايه هي الحاجات المهمة نكتبها؟
لو انت في حاجة بتتلخبطي فيها، يعني في question you usually forget, write it down. في حاجة مثلا كل ما بتيجي تعملي مثلا introduction مثلا من اللخبطة بتنسي opening questions مثلا اللي هي like what seems to be the problem, how can I help. في ناس من الخضة بتخاف من الحاجة دي، اكتبيها أول حاجة عشان ما تنسيهاش تبقى قدامك. اوكي لو في words هتفكرك بحاجة في الكارد you can write it down. Why not? You can do this. This first time to me and I want to start from beginning. Is it possible? First time to go through OET? It's okay. It's one of the easiest tests. One of the easiest tests you can ever deal with it. Okay. If your level is upper intermediate or above, you can basically do it by yourself. My advice usually for people before they decide whether to start a course or not, first of all, choose a teacher, an English teacher. Okay. Secondly, do some basic placement tests. You can find this online everywhere. Thirdly, try to go through the materials online to see, at least do one test of each section. If you feel like you can go through it, go ahead. If you feel like you're lost, you can choose going through a course. Just don't worry, it's very easy, you can do it. معنى كده لو لقيت الكلام على تحاليل ده معناه اني عارف المريض وشفته قبل كده. طبعا نتكلم على تحاليل investigation results، يبقى احنا شفنا بعض من ساعة، شفنا بعض من ساعتين، من يومين، من 3. اوكي طيب. Well, okay, so let me tell you that it was a pleasure having you all around. I hope that this was a helpful session for you. Thanks for everyone who shared today. Thanks for first timers, okay, who are trying. Yes, I will, inshallah, arrange a writing session, online session as well. We usually do this, but I will try to do برضو a mock test. مش هفقد فيكم الأمل. هحاول أعمل لكم برضو mock test, online mock test إن شاء الله. Hopefully it works. وبرضو الناس تكون يعني شافت الموضوع وفهمته وتعرفت عليه. Okay. Just in case if I want to start with you, what is the way? You can contact me on Facebook, okay? And there is a number of my sister, okay? And she will help you, inshallah. Thank you. شكرا لكم جزانا وإياكم. إن شاء الله أشوفكم على خير. Thank you. It's happy to have you around. Thank you. Bye bye.
شكرا يا باشا، كتر خيرك.
شكرا. أشوفكم على خير. باي باي.
see.
مع السلامة. مع السلامة.